Hey, what's going on, everybody? Troy Rawlings here. Welcome to another exciting episode of Meet the. And today we have the Renaissance man, musician, fine artist, photographer too. Are you a photographer?
I do a little photography.
I guess Renaissance man put all that underway. And also, I guess is it facial plastic surgery, cosmetic reconstruction, all inclusive. He's a Beverly Hills 902. Are you 90210?
90211.
90211 is gangster. No, the 90211. Without further ado, give it up for Dr. Carl Truesdale. How you doing, Doc?
Thank you. Thank you. I'm great. Yourself?
Oh man, I'm thanks for taking the interview on short notice and right after he did a client. So I wanna jump in because I was telling somebody I don't know, nor have I. I've seen a couple, but not in Beverly Hills. I don't know of any black plastic surgeons in Beverly Hills. I haven't seen an advertisement, and I don't even know how we cross paths. But I was like, and then I looked at your page, and then I saw what you was doing. I was like, who is this young brother? So, all right, let's. Like I said, I do it. I've been jumping around a bit. Let
Yeah,
everybody
no
know.
worries.
Carl Truesdale, Dr. Carl Truesdale. Where are you originally from?
So I'm from upstate New York originally, small town, Corning, New York, which is, people might know Ithaca, so maybe 40 minutes from Ithaca. Grew up there, born
Did
and
you go,
raised, and left
did you go to
for,
Cornell? Cornell
what's
is.
that?
Did you go to
I didn't
Cornell?
go to Cornell. I went to Morehouse, actually. So I went down south to Atlanta,
Oh,
where I double majored in biology and Spanish and finished my degree at Morehouse, and then went to the University of Pennsylvania for medical school and did an extra year of research there as well. And then I went to the University of Michigan, where I recently finished my head and neck surgery residency program. And now I'm here in Beverly Hills doing my facial plastic and reconstructive surgery fellowship. And this is the place where I plan on opening up my practice next year. So exciting and long road, but it's super worth it, and love to do everything that I get to do.
yeah. So, all right, let's go back. Came up in New York. Uh, let's start. Let's start. I told you we're gonna. So you came up in New York. So upstate New York. Nice. Sorry. What did your parents do?
So my dad, physical chemist. So that's where I had the science. And my mom, she's an artist, very spiritual woman as well. So those were the two kind of pieces of who I am. So the artist and the scientist. And that's, I'm pretty much the melding of both of my parents in flesh. So my dad, very analytical, very logical. My mom, very free thinking, very creative. And so I just happen to get the best of both worlds. And yeah, so I grew up there, youngest of four children. My parents met when my mom had already had some children. So she was a single mother. My dad met her, they fell in love, and I was the product. So my older siblings are about 10 years older than me. But how I got into medicine is I actually had a baby brother who passed away from trisomy 13 when I was very, very young, like very, very young. And at that point, I was
What
very
was it?
distraught. Trisomy 13. So it's a genetic condition where you have an extra chromosome. So similar to
Mm,
trisomy 21 or Down syndrome, but it's a more severe type of mutation or kind of a genetic disorder. So people who are affected by this condition, unfortunately, have more severe effects. Very often, they have cardiac defects that
mm,
actually make their lives shorter. And so my brother had one of these. And when he passed away, it made me really want to learn about medicine. So I found myself in the library at home with all the little encyclopedias and things, reading about his condition and other conditions. And it kind of dawned on me, I love science. I want to use science to help people. And so at that young age, 10 or 11, I actually decided I want to be a doctor. And so I made everything happen to point me towards that goal. And so that's what I did.
Youngest of four kids now, were and then about 10 years older than you. So 10 or 11, are you're by yourself? Are you like the kid in the house by
Yeah,
yourself?
yeah, exactly. They were
In and
just
out.
about, yeah, exactly. Yeah. But, like, it was a formative time for me. It's kind of interesting that kind of set the course of the rest of my life, that one event. But it's something that got me through medical school. It definitely motivated me through high school and to achieve everything that I've gotten to. Obviously, I'm not doing pediatric cardiac surgery, but I'm doing something that I love, and it is the melding of the science, medicine, surgery, and artistry, which is kind of the other piece of how I identify as an artist, a portrait artist. So it's like the perfect place for me and what I'm supposed to do on Earth.
Right. So how old are you now?
So I'm 32 years old.
Okay. So you're still young, but it's
I'm
like
a young man. Yeah, that's right.
But so the amount of focus, but I like the fact that you said that's what started you. What guided you towards plastic surgery? Was it really the art? What guided you that way?
Right. So when after college, you go to medical school, and in medical school, you have kind of two big choices. Either you can go the medicine route, so that's kind of an endocrinologist, a pulmonologist, or a general medicine doctor, internal medicine, or a surgical route. And now I knew that I loved working with my hands. I knew that I had so many hobbies, and I liked the immediate effect of seeing a problem, fixing it with my hands, and then being able to kind of work from there. So I knew I wanted to do something surgical. In medical school, the first year of medical school, I went to a career panel where there were several different specialties, different doctors, interventional radiologists, cardiac surgeons, otolaryngology, head and neck surgeons, plastic surgeons, orthopedic surgeons, and they all talked about their specialty. And what really stuck out to me was in otolaryngology, or ENT, head and neck surgery, there is a wide breadth of conditions that you can treat, pretty much above the shoulder minus the eyes and brain. You treat young patients, newborns, to people who are very, very old. You treat people who can't hear, you give them their hearing, people who can't speak, laryngology, improve the voice, take out head and neck cancer, and then also reconstructive surgery and cosmetic surgery. And so it has so much in it as the medical background, as well as doing a bunch of surgery. And so that really drew me in. I've had several really great mentors over the years who've been able to help shape me. And so I decided I wanted to be an otolaryngologist, and come to find out there's facial plastic surgery, which is a subset of otolaryngology. So
Okay,
just like,
now you have to break down.
I'll break it all down.
Otolaryngology?
Yeah, I can even make it even more. So otorhinolaryngology is the full word for it. Otherwise, rhino, laryngology. There it is.
So ear, nose, and throat, dude. No.
ear, nose, and throat. That's what it goes by. But within ear, nose, and throat, or ENT, a lot of people don't know we take out head and neck cancer. We restore hearing and do cochlear implants, or voice surgery, or sinus surgery, or sleep surgery, pediatric, take out tumors along the skull base.
Y'all
so
see me,
skull base
when y'all see me writing, that means I'm taking notes, and y'all should be taking notes too.
Got it. Take notes. It took me 5 years of taking notes to be able to figure it all out. But
it's second
yeah,
so like I'm telling you.
Exactly, right? You telling me you don't know how to say otorhinolaryngology? Otorhinolaryngology.
Otorhinolaryngology. That's my word. I'm a flow with it. I'm gonna say it for no reason. It's like,
I'm gonna start calling you Dr. Troy.
All right, so this is one. Now that I know that the ear, nose, and throat part, but especially we have a lot of situations where you see people getting nose jobs. It's pretty. I mean, when I got to California, I had never seen so many 80-year-old women with 2-year-old breasts before in my life. I never seen, but I know some people even back east, in Baltimore, and who got nose jobs for different reasons. They were having problems
Hmm.
breathing. Some people
Right.
were having sleep apnea. I know people got nose jobs for sleep apnea. There's a lot of. So when you're talking about ear, nose, and throat, are there times when people get plastic surgery? You're like, oh, they got plastic surgery. I don't know why they get work done, but it was something else. The reason
Yeah,
they.
absolutely. Absolutely. So plastic surgery in general can be broken down into two different things: cosmetic or reconstructive. And so I do all of it, primarily cosmetic, but you know, a big part of the reconstructive side is related to cancer. So after cancer, you cut the cancer out, you have to put the person back together. So, for example, if a person had tongue cancer, you might need to remove a large portion, if not the entire tongue. The plastic and reconstructive component of that would be to build them a new tongue. That could be from tissue borrowed from the forearm, or maybe the leg, or maybe bone from the leg. It all kind of depends. But that is facial plastic and reconstructive surgery.
Have you ever built a new tongue?
Yeah, sure.
Did it? Does it work? Does you have? What do they do as far as the nerves and the taste buds?
Right. So it doesn't function for taste.
You
But
got,
when you're thinking about when
you
you're
got
thinking about rebuilding a tongue, what do we use a tongue for? We use it to speak, we use it to swallow, and we use it to in some way breathe. And so when you're trying to reconstruct something, you want to think about its original function. So when the tongue is gone, we want to give a person the ability to close their mouth, control their food bolus or what they swallow, and make it so that they can at least have some type of speech. And so that's what you're trying to accomplish. It's not going to taste. Depending on how much of the tongue that is removed, it won't necessarily be able to move spontaneously. Most of the time, you're able to do a free flap or a different type of reconstruction where there's some portion of the tongue that's left. And so that portion of the tongue can move and, function to assist in speaking. But for the most part, you want to just, restore the form and the function. So that's just one example, just one small example of the reconstructive side of facial plastic surgery. If someone has broken their jaw, we put it back together, or in a motor vehicle accident or a gunshot wound to the face, that's facial plastic and reconstructive surgery. So it's not just all the cosmetic, I want a cute nose or facelifts. It's also people who have skin cancer and have holes in their face and they want to just restore their form. So this is all facial plastic and reconstructive surgery.
Yeah, we recently lost. It's amazing. I don't believe in coincidence, but it's amazing that we're having this conversation because we recently lost. And for those of you who are watching, we try not to date it, but we happen to be in the most historic time in our lifetime of history. 2020, you got pandemic, COVID-19, uprising, coronavirus, and we recently lost a guitar great, rock great, Eddie Van Halen. I guess he had different kinds of cancer, throat cancer, but they mentioned that he had cancer and lost part of his tongue. And I had been thinking this is about a week ago, Eddie passed. And the whole time I'm thinking, wow, they had to take out part of his tongue. How is it that I'm seeing interviews years later, like he's talking and he seems pretty normal? I wouldn't know they took out part of his tongue. I wonder how much they took out, or was it a little piece in it? But you're explaining something to me that makes so much sense.
Right.
Yeah, he smoked like a chimney, sadly. So I'm sure that attributed to the cancer, and because it was in his throat. Now, is that always? Because I guess you know a lot about cancer from what you study. Is that always the case? Someone that smokes. Now he was a chain smoker, like put his cigarette on his guitar and play.
Mm-hmm.
So they mentioned it was cancer, but they mentioned they removed part of his tongue. So now I understand that a doctor can come in and it makes so much sense. I did some master barber by trades, one of my trades, and I used to go to, I want to say it's Kennedy Krieger in Baltimore. I can't remember which one it was, if it was Kennedy Krieger, which one, but they dealt with a lot of people that had, it could have been a car accident, all kinds of stuff, people that needed their hair cut, but they head trauma.
Yeah.
So I remember going in and cutting someone's hair, and the guy was just he was there, but he wasn't there.
Mm-hmm.
And this side of his head was just sunk in.
Mm-hmm.
And after, I was like, okay, he must have had head trauma. But I'm not thinking the side of his head is sunken in because that part of his brain is gone and they're working on it.
Well, it could be a bunch of different things. Obviously, I would have to look at the patient's, medical record. But when you see that indentation and you see a scar, it means they've at least had a craniotomy, which means some surgeon or during the trauma has taken a portion of the bone underneath the scalp away.
Yeah, this guy was hit in the head with a cinder block. So I knew that part of the story.
Yeah.
So
yeah.
The reason I say I know, because I cut his hair, and then one day I came back and walked past his room, and I heard somebody say, "Hey," and I was like, and I looked in, and I'm like, because his whole head was that, and I'm like, how does he even know? Like, I didn't even think he knew.
Right.
I was there.
Right.
So.
Oh, did I lose you?
In your residency and everything that's been going on, have you seen everything when it's came to the head reconstructive?
Yeah, everything above the shoulder is my specialty, minus the eyes and brain. And honestly, we work very closely with neurosurgeons to access the brain. So if someone wants to get to the brain, sometimes the best way to get to the brain is through the ear. Sometimes it's through the sinuses up along the skull base. Sometimes we just help them get through the brain, or to the brain through the skull, so taking the skull off. So we work very closely with ophthalmologists and neurosurgeons because we all share this area, working together.
All right, so fellow, I saw it had fellowship. So when you're doing a fellowship, how does that work? You decide, is it, because you said you did your residency and then you did your fellowship. So right. What is the difference between a residency and a fellowship?
Got it. So when you finish medical school, you're a doctor. MD, you're a doctor. That doesn't mean that you can practice medicine, though. So generally, you need to do a residency. A residency ranges between 3 and 7 years, depending on your specialty. For head and neck surgery, what I did, it's 5 years of intensive surgical medical training, usually in a hospital. At the end of your residency, you are specialized. You can practice medicine. So I could have started, working in a hospital. I could have been your ear, nose, and throat doctor and done all of those subsets, including facial plastic surgery, finishing residency. But what I chose to do is do an extra year of subspecialized training. And what I'm doing now is I'm working in Beverly Hills with Dr. Andrew Frankel, who is a world-renowned plastic surgeon here. He's worked for over 25 years here in Beverly Hills, and he is a fellowship director, meaning these are kind of the gatekeepers for the fund of knowledge. So I'm his basically apprentice. That's the way you can think of it, where you learn the nuanced techniques that he uses, as well as his business, his inside and out of how he takes care of people, such that you have even further advanced your training and your education, even after those 5 years of residency, 4 years of med school, plus an extra year of research, and 4 years of college. So I'm in this to be the best, and it's an investment in myself. What this year is, if anything.
Right. So how long? How long have you been in Los Angeles and in Beverly Hills?
4 months. 4 months.
Brand new.
It's
an exclusive, ladies and gentlemen. Exclusive. The boy's bad. I've seen some of his work. He got people shocked on his social media. I'm like, yeah, This is all the document right there. It's just finished. I'm like, okay, let us know. No, I'm good. So, all right. So I'm gonna go back because you talked about what you wanted to specialize in. You talked about how you were intrigued by ENT and you went that route. Why plastic surgery though?
Right.
Was it more so not only do I like this, I can go a bit further because of my specialization. I don't know if everybody goes through ENT before they decide to go into plastic surgery. I know it makes you better at what you do. I've seen some because of your understanding, but why plastic surgery?
Yeah, so ultimately I chose plastic surgery because I am an artist. And, it after a long period of time of thinking within ENT, right? I could have done pediatric ENT, I could have done head and neck cancer full time, I could have done laryngology, professional voice, otology, sinus surgery. What kept coming back is I'm an artist, I'm a portrait artist who focuses on the head and neck and the face. What better way to use your artistic skills, make people happy, make people, whole again when it comes to reconstruction, than do plastic surgery and within ENT. So that's how I decided to do ENT. It was a long process though, because I love all of those other aspects. I love taking out head and neck cancer. I love doing a surgery and making someone be able to hear again. I love, making someone be able to have speech or be able to breathe because they have sinus issues or polyps or whatever it may be. I love all those other aspects, but I wanted to dig in and be a specialist, dig in and really use some of my talents, the things about me that are intrinsic, inherent to who I am, and that's an artist. So that's how I got here.
And you still do art. So
yeah.
What is do you think you'll ever get to the point where that's not one of your pieces behind you, is it?
No, this is not.
Oh,
No, I'm actually still in the office because I saw a patient late. So I'm just here in the office. This is our beautiful waiting room in the Lasky Clinic in Beverly Hills. So feel free to come by and see me.
Look, I'm going by there just to break bread and take some selfies. I'm like, it's gorgeous. The place is gorgeous, ladies. Ladies, take your girlfriends over post COVID. You don't be walking through like, oh my goodness, So, artist and the musician. I saw a lot that you were doing with the Music Point. So that's like the perfect storm. Because I have no, I'm serious. Because I mean, come on, you're a Renaissance guy, educated doctor, and you get into Beverly Hills. You're an artist, fine artist, and you're a musician. So in any other time in history, you kind of have your place as far as how to set your modes in Beverly Hills, a town that kind of thrives off that kind of energy when you're networking, when you're doing different things. Right. So what do you want to do to further it? Or is it just something that you enjoy to do for your own peace of mind, your own mental health, your own, sanity and sanctity? Or is it something that you want to take further as far as the artwork?
In terms of my artwork, that's not related to doing surgery or dealing with patients, because I consider that artwork as well, which is the highest form of art in my humble opinion. What I would say is I'm working on several different big pieces. There's a big oil piece that I'll be showing on Instagram relatively soon that is probably about 6 feet by 4 feet. I'm working on that right now. So there's always that creativity, and I would be very unhappy if it stopped. So it's always an effort to try to better myself and to learn new techniques, or to learn different color theories, or the way that people see the world, or try maybe modern or impressionistic pieces, things like that. I'm much more of kind of a realistic renderer. But I love exploring and, shaping things with light and color, sometimes black and white. There's no ultimate goal. It's just the focus on the process of experiencing the art, creating. That's what I like. There's no ultimate goal for me.
Very cool. So, Beverly Hills. Now, I know you said you wanted to start your office there. So, are you looking to start? You said it's a year that
Hmm.
you do fellowship, and
Yeah,
you
so I'll
want
be done in June, and I'm looking for office space. I'm looking for a bunch of things right now. So the interesting and fun, great thing about my practice is obviously I'm done with residency. I'm a trained physician. So I see patients now. I do surgery now. So you don't have to wait to come and see me if you'd like to. I'm here in the Lasky Clinic doing my fellowship, and because I'm doing my fellowship now. I'm able to offer really great prices that other surgeons can't offer because I have no overhead and I have no expenses really. And so take advantage of that while you can.
right. He said, a smile like he's like you should. Literally, you're gonna have a painting that says "Should have caught me last year." Last day of the June. Did it seem like it went quick? And well, let me say this because we're in a different point in time now. Have you seen an increase or decrease as a doctor in what you do during this season and where you are?
So I'll answer it. Obviously, this is an unprecedented time, as you already kind of said. When I came to Los Angeles, I just finished my head and neck surgery residency. So at that point, I was still very much taking care of COVID patients on a daily basis as an airway expert, because
Oh,
within
oh
ENT
right.
head and neck surgery, we do tracheostomies, we're airway specialists. So and that was, some of the issue with those patients is they prolonged ventilator needs, intubation needs, where I was performing tracheostomies and helping with that. So very much a different thing that I was doing in Michigan in June before I moved out here in California.
Mm.
Now I'm pretty much doing cosmetic facial plastic surgery full time. It's a different thing. From what I've heard and what I've seen is we are very busy. And that's probably multifactorial. People have extra time on their hands, extra time to recover with a mask. They are looking at themselves in Zoom every day at all of their imperfections or things that they don't like about themselves.
I did not think
And
about the fact that they can be walking around like, "Oh yeah, girl, jeez,
right,
yeah,
right.
COVID, COVID."
I'm good, right? The
I,
other thing is, people haven't been able to travel. They're not spending, money on other, shopping or sporting events. They've saved up money, so they have a little bit of extra money to save and to spend, and they want to do something for themselves. So that's where the plastic surgery, the facial plastic surgery piece comes in. So
now, would you see? I don't know the whole extent of what you do. I looked at some of the things you do. I know you do basic things as far as Botox and so. Now, for someone that's looking right now, someone says, okay, because I've 90% of my audience, especially for my sex, love, relationship, comedy tour, all that, women. And I've heard women over the years talk about, well, I just want to, I was like, why are you touching your face? I just want to kind of get the little, whatever, Now, for those that are thinking about it, thinking about doing something, they're looking at something, they like to do a little something, but they don't know how to do it most natural way, and I
hmm
like I've seen you have men and women.
hmm
And we know a lot of the much older Hollywood, that's their thing. To make sure that their face, if nothing else, their face still looks like, hey, that's Bob Hope. Like Bob Hope been dead for 20 years. It's like, oh, who is that? It's like, so to calm any fears, what are the scenarios that you take people through lightly, which you can talk about here? What are the things
yeah,
that you take people through and decide whether or not this is good for you or it's not good for you? What
right,
some people may want something and you take them through the course. That's the great thing about you being an ENT as well. You can take them through the courses like, okay, but if you do that,
right. Right. And so a lot of it comes down to finding a doctor that you can trust who is skillful and has the training to be able to back up the effect that they want to accomplish. But the first thing is you want to be comfortable. And so if you are a patient and you are thinking about doing something cosmetic, you should be in an environment where you can have a conversation with your doctor. You're not going to be rushed. You feel the confidence from them, and you can ask them what they think might be a good change. It's always nice to start with a reference point with a patient. If they have a concern, they say, "Hey, maybe I'm bothered by my forehead lines, or maybe I'm bothered by my receding hairline," because then we can start a basis. But sometimes patients don't quite know exactly what they might benefit most from. The next thing is coming to it from a positive perspective, because none of the cosmetic stuff is necessary. It's not necessary surgery. Now, when I was taking out people's head and neck cancer and helping put them back together, that is a different type of surgery.
Right.
Elective plastic surgery should come from a place of happiness, from a place of being excited about it. If someone's fearful, that's not a good place to start. The other thing is having a realistic expectation. And so if you feel like there's something that's bothering you and the doctor doesn't feel like that's something that is worth changing or correcting or anything, then it's probably not a good idea to do it. But if the doctor sees it and the patient sees it, that's a really good opportunity to try to make a positive change. And so that's what you're looking for. The doctor should have the knowledge to be able to explain what options are available, both surgical, non-surgical, non-invasive. Some of them might be medications. Some of them might be creams. Some of them might be laser. Some of them might be injections or even surgery. But that doctor should be familiar with the range of procedures. And if he or she doesn't provide it, he should be able to give you a referral to someone who can help you.
So, no, that's golden information, because I know there are a bunch of people that are looking, and that's probably why business went up too. You got people that's been looking in the mirror like, "Oh, girl, you got to come out of this right. You can't." Or this guy's like,
right.
you can just yeah. So, there's something I wanted to ask that was make sure I covered anything. Oh, top 3 questions you get as a plastic surgeon with someone coming in that we may have missed. Top 3 questions you get when someone is saying, "I want to get this." What's the top 3 things they usually want to know outside of how much it costs?
What's the recovery like? What are the risks? And outside of that, those are always very, and then it's the question of the degree of change. So how much is it going to change? How much straighter is my nose going to be? How much more lifted is my neck going to be? Or how much more full are my lips going to be? That's the degree question always comes up. I could probably think of others, but downtime, risks always come up. They always want to know that. And obviously we always discuss it.
And for this, and I'll close with something else before we get out of here. I'm not going to keep you too long. I know you want to get home and get some nourishment. It's a long day, long Los Angeles day. Do you have a team? So some people may be looking, "Oh yeah, I'd like to get some face done. What I really want done is these and this and that." Do you have a team of people that you formulated yet that you really trust with have you ever gotten somebody who said, "Okay, we're going to start with you and we're going to end all the way down to, I got this thing on my foot. So we're going to go straight down the body." And they come in,
well,
I
just moved to LA, so I'm still building some of those referral kind of patterns, but I do have some relationships with, some people around town in terms of dermatologists or people, really good estheticians, body plastic surgeons. So if you have a question, just DM me or email me or reach out to my office, and I'm happy to provide you with those names. Because, as much as I would love to help you with your Brazilian butt lift or your abdominal liposuction, I don't do that. All I do is face. And so I'm happy to.
How many DMs do you get? It's like, "Oh yeah, the face stuff is good, but I want you to look at this right here." Can you?
All the time. It's so funny.
He was like, look, you don't want to see what's in my DMs. And like, all these women flirting with you? He's like, no, they want to pay me. He's like, what? Like, what is going on? I'm in the wrong business, bro.
Yeah.
So
No, I mean,
5 years.
it's funny because people will talk to me about like abdominal liposuction, for example, and I do that, but I don't do it for the purpose of making the abdomen look smaller. I take fat from the belly or the leg to inject into the face to restore volume.
Oh,
So, it's a different focus than what I do. But
I did have a question about that. Well, to in the face. So, okay, so when you remove, so when you do that, are you taking fat cells or what kind of cells are you taking usually? So it's fat cells, and when you put them in another part of the body, does anything happen to it? Like, how does the body react to that?
right.
Does it react
So
different?
yeah, so it depends on where the fat is coming from. But the fat that you take away, it's gone from the place where you took it, the donor site. So that fat's gone. So that's the nice thing about abdominal lipo, is that it's gone forever. Unlike weight loss, where the fat cells haven't gone anywhere, they've just gotten smaller. But your question is, what happens to it once you inject it? Now, it needs a blood supply to be alive because those fat cells are living tissue. Whenever you do any fat grafting, or that's what we call it, only a certain percentage, really only about 30% or so sticks around. So you tend to do a little bit of an overcorrection, knowing that some of those cells are going to resorb over time. And once they're there, it's your tissue, it's your volume. And if you gain weight, that will gain weight. The fat will get bigger. If you lose weight, the fat will get smaller. And so that's kind of how fat behaves when you inject it in the face.
But when you remove fat from an area, there's cells, so it never goes back, or
Yeah,
you
the
can.
cells don't grow. The fat cells don't grow back. They're gone.
So if a person gains weight in that area, what happens? Or
So, for example, if you take a person and you took fat cells from their belly and you inject it into the face, normally, right, the person gains weight. They would gain a lot more weight in their belly, depending on the person's body composition, than in their face. But in those people, they'll gain weight in those
in
fat
the face,
cells. Yeah, in the face, and so it's still living tissue.
you you're good. You're good. All right, doctor. Dr. Carl Michael Truesdale, Dr. Carl Truesdale, where do you see yourself? Where would you like to be in the next young man, where would you like to be in the next 5 years? Overall, not just practice, overall.
Happy, very happy. A lot of happy patients, great relationships, healthy, myself and the people around me, and making a positive impact. That's global. I know that's very broad strokes and maybe a little cliche, but that's speaking from the heart. That's where I would like to be in terms of my practice. A busy, thriving facial plastic surgery practice where I am operating at least 3 or 4 times a week. I am making a lot of people smile, and my name is out there. I'm a known entity, known force in the world of facial cosmetic surgery. Yeah, that's where I see myself in 5 years.
Y'all make some noise wherever y'all are. Even some women are crying, like, I gotta call him. Dr. Carl Truesdale, thank you. Let everybody know how to get in touch with you.
Yeah, so if you want to reach out to me, you can find me on Instagram at dr.truesdale, or you can visit my website, drtruesdale.com, truesdalefacialplasticsurgery.com, or you can view my art if you'd like to at carltruesdale.com. You can reach my office, and we'll post the number to my office, and you can call for an appointment, a consultation, or we can set up a virtual consultation. Happy to see you for any of your needs related to facial plastic and reconstructive surgery, any issues with your skin, any volume issues, breathing issues with your nose shape, facelift, blepharoplasty, brow lift, anything facial, I got you. So yeah, come see me. I'm happy to see you and take care of you.
Thank you so much, Dr. Truesdale. We'll be talking soon. I appreciate you.
Thank you so much. See you later.